If you've ever rushed a sick pet into an emergency room, you know the exact pit in your stomach. It is a high-stakes, emotional environment. Take a look at this chart tracking consumer prices over the last 10 years. While the baseline of overall U.S. inflation has remained relatively steady, the cost of veterinary care has surged by 60%. That surge has immediate consequences. Routine preventative care visits are dropping, while animal shelters across the country are reporting crisis-level surges in intakes. People who view their pets as family members are being aggressively priced out of basic medical care. Even as consumer costs skyrocket, the record revenue is not reaching the veterinarians or the technicians working the floor. This data visualization shows the actual lived reality inside those clinics. 72% of veterinary professionals report feeling completely exhausted, and 1 in 3 are actively considering leaving the profession entirely. The metrics get much darker. Data now shows that 1 in 6 veterinarians have considered suicide. If clients are paying record-high bills and the clinic staff is mentally breaking, there is a massive disconnect between where the money starts and where it actually ends up. The independent neighborhood veterinary clinic is becoming a relic. It has quietly been bought out by Wall Street. For decades, the unquestioned standard of veterinary medicine was independent, community-based ownership, local doctors running local businesses. Just over a decade ago, corporate ownership sat under 10% of the industry. Splitting the data by practice type, the current dominance becomes clear. Up to 50% of general practices and 75% of specialty clinics are now owned by corporate consolidators. Private equity firms targeted this sector for a very specific reason. We consider our pets to be family. That makes veterinary spending highly resilient, generating consistent returns even during deep economic downturns. There was supposed to be a legal barrier to this kind of takeover. 18 states explicitly ban non-veterinarians from owning medical practices, a rule designed to ensure clinical decisions remain independent of corporate influence. In this flowchart, a licensed veterinarian holds the paper ownership of the clinic, but a massive corporate entity, an MSO, attaches itself to the operations. The vet leases non-medical assets from the consolidator. Revenue from patients immediately bypasses the doctor, pooling straight into the corporate MSO. This legal fiction renders state protections practically meaningless. It allows corporate managers to extract capital and dictate how the clinic runs, without ever holding a medical license. That management services organization structure maps directly back to the burnout data from Act 1. When a clinic is governed by a mandate for compounding returns, daily operations shift. Corporate veterinarians report crushing daily patient quotas, a complete lack of control over their schedules, and intense pressure to upsell unnecessary tests to clients. This leads to the devastating reality of economic euthanasia. When corporate algorithms drive prices up, owners are increasingly forced to euthanize curable pets simply because they can no longer afford the care. Forcing medical professionals to repeatedly perform economic euthanasias to serve a corporate bottom line directly fuels the industry's compassion fatigue and mental health crisis. The veterinary system has reached a breaking point. It's prompted a coordinated, two-pronged counteroffensive to save the industry. The first solution relies on lawmakers. Policy groups have proposed the Save Our Pets Act, designed specifically to eradicate the MSO workaround at the state level. We can see how this works by returning to our flowchart. The legislation actively strikes out the parasitic components of the MSO loophole, explicitly banning straw ownership loops and enforcing strict transparency on private equity ownership structures. The legislation also targets predatory non-compete clauses that currently trap exhausted veterinarians in these corporate contracts. The goal of this legislative push is to restore true medical independence by legally separating animal health care from Wall Street extraction models. The second solution is happening inside the clinics themselves, a resurgence of the independent practice model, which historically boasts much higher staff satisfaction and lower burnout rates. Looking at this SWOT analysis of independent practices, the strategic advantages sit squarely in the strengths quadrant. Independent veterinarians report superior team culture and deep, genuine integration into their local communities. At the same time, the macroeconomic landscape is shifting. Rise in interest rates have made the private equity business model highly expensive, effectively slowing the rate of corporate clinic acquisitions. New administrative tools like AI medical dictation and automated scheduling platforms lower barriers for independent vets. Small clinics can now achieve high-level back-office efficiency without the corporate overlords. By closing legal loopholes and embracing modern tech, veterinary medicine has a real path to escape the private equity trap and return to its actual mission: healing animals.